Thank you. Good afternoon. How is everybody doing? I know it's getting later in the day and you've been absorbing so much information already. So this will be a little bit of a change in pace, I hope. Let me see where we are. So I'm going to speak about integrative medicine and its role in comprehensive cancer care. And before we delve into the details, I want to invite you to briefly envision your home, your apartment, your dwelling. And imagine what would happen to it if you stopped caring and attending to it, if you stopped repairing things that are broken, if you stopped taking the garbage out, if you stopped weeding your garden, how that would affect your immediate living environment. So very likely there would be dust clouds gathering very soon, maybe bugs, maybe mice, maybe weeds overgrowing the whole garden, right? So it's very easy for us to accept that we have to attend constantly with care and attention to the object around us, to our houses, to our cars, to our loved ones. But we tend to neglect aspects of our health and defer self-care to times when we have vacation, when there's more time, when it's more convenient. So this is part of integrative care, acknowledging and alerting to the aspects of our health that we sometimes don't tend to acknowledge and attend to as much. So my colleague Gary Dang, he calls it optimizing the microenvironment in your body and the macroenvironment around us. So, and today we have a lot of supportive research showing us the effects of mindfulness, nutrition, exercise, stress management, proper sleep, laughter, relationships, and spirituality in their role in overall wellness and health and quality of life. So this is the approach or the perspective of integrative care, acknowledging these whole aspects of health and incorporating them into care. And when I say wellness in that center circle, it's not the wellness we expect to get in the spa, right? It's the kind of wellness that is measurable, for example, quality of life measures, or in our cancer patients, fear of recurrence, bothersomeness of pain. So these soft outcomes that have really significant impacts on the lives of our patients. So in the next half hour or so, I'm going to speak about what integrative medicine means at Memorial Sloan Kettering. And we're going to take a tour in our House of Health, and we're going to start speaking a little bit about what stress means, how to acknowledge the role of stress in the cancer setting. We're going to speak how we address stress therapeutically. We're going to speak about sleep and integrative management of sleep disturbance, and we're going to end up in the kitchen where we're going to speak about challenges with food intake and supplement use. So integrative medicine is a very fashionable term, and it's being practiced in many shapes and forms outside. At Memorial Sloan Kettering, we understand our service to be a supportive service, meaning that we work hand in hand with the oncologist and complement conventional cancer care. And we do that across the whole cancer trajectory, meaning that we try to treat symptoms of the cancer, the side effects of the treatment, promote recovery, and for some cancers, modify risk factors with lifestyle modifications. And we do that with traditional and complementary healing methods, such as yoga and acupuncture, right? And it's becoming really mainstream in comprehensive cancer care. All NCI-designated comprehensive cancer centers offer integrative medicine programs, and the number of centers, medical centers, is really rising. And these centers answer to the demand of their patients who really use all these complementary and alternative medicines. So this is still the NIH survey from 2007, still the largest survey on CAM use in the American population. And you see that it's very prevalent, over 44% in some age groups. And I can tell you amongst the cancer population, it's much, much higher. Newer surveys estimate around 80%. And I'm going to say that most of this use of calm is self-directed, meaning that patients will rely on the internet or their social network to obtain this information about how to use these complementary methods. And most of them won't share that with their oncologist. So it's a young field, and we have a lot of questions that need to be answered, right? But over the last 10 years, publications in modalities such as yoga, acupuncture have been exploding. Now, mind you, not all of these studies are randomized controlled trials, but the evidence is gathering, and we're using that and relying on that. One of the most important things I want to leave you with are concentrated in this slide, because there is a lot of confusion around terminology: comprehensive, integrative, alternative. How do we distinguish, right? So our practice, we understand to be integrative, of course, and one hallmark of integrative medicine is that whatever we use, safety is probably the most important parameter, how we judge a modality. We rely with our recommendations on the scientific evidence. They're evidence-based or evidence-informed, depends on the strength of evidence that we're working with. Inexpensive, that's a relative term, but that's important. We seek to be supportive and complementary and not instead of conventional care. Now, in contrast to that, what is often referred to as alternative medicine is often potentially risky, and that ranges from very invasive dietary regimens to IV vitamin infusions and up to very adventurous supplement use. Often these modalities are based on unsubstantiated claims, right? There's no scientific base to these claims. And often they're very costly. I can't tell you how many times I see patients coming in with pages and pages of laboratory testing that cost them thousands of dollars that really doesn't have any clinical implication. Often these therapies are promoted instead of conventional treatment, right? They reject conventional treatment, and they're touted as curative, again, with no scientific evidence behind it, only maybe anecdotal evidence. So my golden rule is, if it sounds too good to be true, it's probably not true. Okay, so we're going to start our house tour, our house of health, in the waiting room. And for me, the waiting room is a symbol for kind of a clinical blind spot. So an aspect of the patient experience that we as physicians often are not part of, that we don't see, right? And that the patients don't endorse often. Right? They don't endorse the clammy fingers, the racing heart, the sleepless night prior to meeting their new surgeon, prior to the next MRI or the CT scan, or prior to the next blood test, right? So the cancer trajectory is really burdened with a number of stressors that really overlie the whole course, right? Uncertainty, for example, and it's punctuated by recurrent stressors like the follow-up imaging, right? So stress is a big part of the patient experience, especially in cancer care. So most of us, of course, associate stress with nothing good, but most of us know as well that it's, of course, a necessary physiologic response to an acute danger, right? For example, me being stuck in the N train for 30 minutes on my way to giving this talk is an acute stressor, right? Even though it's not dangerous necessarily. But me having to rely on this train every morning to get to work, that maybe qualifies as a chronic stressor. And we know that the neuroendocrine changes, the biophysiologic changes in the stress response, if they become chronic, they really have an impact on our health, on the circadian rhythm. Our ability to sleep, for example, can be affected, on metabolism, increasing risk factors for diabetes and heart disease, and on immune response, for example, increasing our risk for viral infections. Most of my patients contribute their cancer diagnosis to a stressful event in their life or a stressful time in their life. They blame their cancer diagnosis on that. The truth is we don't have any scientific proof that stress, even chronic stress, can cause cancer. There have been several studies that even looked at personality types or traumatic life events, and we really don't have any link between the incidence of cancer and chronic stress. However, we do know that stress impacts lifestyle, right, and food choices, health behaviors, and so on. And that in turn can affect resiliency and overall health. There are observational studies that do see an effect of stress on the cancer course. So, for example, stressful life experience and depression are associated in some studies with poor survival or higher mortality across several cancer types. And social isolation or poor quality social relationship can be considered a risk factor, just like alcohol use or smoking. There is also a number of laboratory studies, animal studies, that demonstrate the effects of stress on cancer spread and cancer growth. And here you see some of these studies summarized, studies in mice that have been stressed and the result of increased growth and increased spread of cancer. So there are animal studies that seem to imply that stress may lead to faster metastatic spread of cancer. And one of the landmark studies that are often quoted in this context has been published already more than almost a decade ago in Nature. And this is a study in a mouse model, mice that have been injected ovarian cancer cells in the laboratory. And these mice were stressed in different manners through social isolation, hypothermia. They had to swim for hours. And across all these stressors, they noticed that the mice that were stressed, they had an increased spread of their cancer, right? And the more they were stressed, the more that was pronounced. And some of these effects they were able to reverse by giving them propranolol, which reverses some of the physiologic effects of stress. They concluded that stress, the neuroendocrine changes of stress, may increase angiogenesis, the ability to form blood vessels in the tumor and assist the tumor to spread faster in this way. So chronic stress and cancer. So those slides were maybe stressful for some of us. So we're going to head into how we address stress therapeutically. And the most evidence-based way we do that is, for example, mindfulness-based stress reduction. And that's an 8-week curriculum that is being taught, that was founded at Mass General in Boston over 40 years ago, and now it's being taught across communities, schools, prisons. It's an 8-week class where you're taught to do a special meditation technique called Mindfulness Meditation, gentle yoga, mindful communication, and stress awareness. And it has been studied in many settings, amongst them across several cancer populations, and has been associated with relieving anxiety, stress, and fatigue, sleep disturbance, and improving quality of life. So in this meta-analysis that was published in JAMA a few years back, they looked at several different ways to meditate. So mindfulness meditation that we call present-centered, non-judgmental awareness, or the practice of that. And mantra meditation, which relies on repeating a mantra or a sound. And they looked at these types of meditations for several outcomes: anxiety, depression, stress, and they saw overall a favorable outcome for most of these different outcomes. So they concluded that mindfulness meditation programs can reduce the negative dimensions of psychological stress, and they found moderate evidence that it may improve anxiety, depression, and pain. So in this slide, we see a Tibetan monk being prepared for an MRI, and this is how we obtained the early meditation studies that demonstrated that mindfulness meditation actually leads to structural changes in the brain. Today, we also know that you don't have to become a monk to have these positive changes to your brain, but we also know from meditation naive people that went through, for example, 6-week or an 8-week meditation intervention, that some of these brain changes can be demonstrated after that, after some practice of meditation. And these brain changes correlate with a better attention, more emotional flexibility, so the subjectively reported positive effects of meditation, right? Another favorite tool of ours that we use for stress reduction is expressive writing or journaling. And one of my favorite studies that looks at that has been done in kidney cancer patients that were divided into 2 groups. One group was asked to do expressive writing, so writing about their deepest fears and hopes in the context of their diagnosis. And the other group was asked to just report on very neutral topics, such as what they did yesterday, what they ate yesterday, and they were followed across their cancer course for 10 months and evaluated with multiple questionnaires. So you see here, the blue line stands for the expressive writing for the journaling group, and the yellow for the neutral writing group. And so they were found that across those 10 months, those that did expressive writing had less cancer-related symptoms, less fatigue, and better physical functioning overall over the course of their disease. Now, these are not results that I can promise should you start to journal tonight, right? But it's an interesting way to look at these mostly psychological interventions. Another relaxation practice that is very useful, especially in the acute treatment setting of cancer, is guided imagery, which is like meditation. However, it relies on a narrative that invokes very vivid sensory images, and these images seem to replace or aim to replace some of the negative images we may have about cancer treatment or about a specific medication. And while obviously we're targeting stress reduction with these interventions, there have been studies done that demonstrate that there may be effects on the immune system as well. So, for example, a randomized controlled study with 90 breast cancer patients that were followed over 9 months. They were taught visualization practices, and those that were practicing visualization practices, they were shown to have increased markers of cellular immunity, such as activated T cells. And these immune changes, the strength of these immune changes correlated with the frequency of their practice. Or in these prostate cancer patients, in this randomized controlled trial with prostate cancer patients, these had visualization practices before and after their prostate surgery. And here, too, they observed increased natural killer cell cytotoxicity, which is a marker that shows us how well the immune system is destroying foreign cells. So part of the immune system that we need to fight infections or also fight cancer. And we see that in the group that did visualization practices, these markers were increased. And in the control groups, those that did not receive visualization practices, these markers went down, which we expect in the setting of a surgery, right? So it's important to note that we don't know the clinical implications of these immune changes yet, but it's an interesting approach to look beyond the psychological impacts of these relaxation practices. All right, we arrived in the bedroom, and we're going to speak about sleep disturbance and insomnia, which is extremely, extremely prevalent in the cancer setting. So I'm going to ask, how many of you have slept less than 7 hours on most nights over the past month? Oh, boy. All right, so I won't get offended if you happen to fall asleep now during the session. Okay, so the conventional tools we have to address insomnia and sleep disturbance are a number of medications which are extremely useful for temporary relief. However, if we're dealing with a long-standing problem, these often are not enough to break that self-perpetuating cycle that keeps insomnia present in the lives of most patients. Now, sleep is one of our major focuses in the integrative medicine consultation because of the suggested significance of sleep in the immune response. So there are studies, for example, that demonstrate that patients that sleep on a regular basis for less than 7 hours are 3 times as likely to catch a viral cold. If you sleep less than 5 hours on an ongoing basis, you increase your risk for high blood pressure and heart disease. So it's very prevalent, as I said, both in the cancer population as well amongst cancer survivors. And it, of course, has severe implications on the lives of our patients, affecting fatigue, daytime fatigue, of course, memory and cognition, as well as their ability to function in their social life and their professional life. So the first thing we do when we deal with sleep disturbance is to clean up the sleep habits, the sleep behaviors. For example, putting the patient on a regular regimen that supports their circadian rhythm with regular sleeping and waking times, increasing physical activity level, establishing a routine that helps the patient to wind down, and that includes to avoid physical, cognitive, or emotional stimuli prior to bedtime. That includes dimming the lights, dimming the sounds, staying away from screens, right? Most of these screens emit a blue spectrum light that if you're exposed to it for long enough, it may affect your melatonin production. So, of course, avoiding chemical stimuli such as caffeine, alcohol, and nicotine, limiting naps to 20 minutes, right? And then finally, establishing a regular relaxation practice, and we spoke about some of them. So we spoke about mindfulness meditation, guided imagery, we spoke about expressive writing, and there is some data supporting hypnotherapy or self-hypnosis as well as progressive muscle relaxation or gentle yoga practice for the support of sleep quality. Now, massage and acupuncture, especially acupuncture, has also a lot of data supporting its use and therapeutic use as an adjunct treatment in insomnia. Okay, so we arrived in the kitchen, and the first thing I want to address is an issue that comes up a lot for my patients with gastrointestinal cancers and stomach cancers: how to maintain weight, how to optimize nutritional intake. So the things that we work most often with, of course, in conjunction with our nutritionists, is to establish small, frequent meals every 2 hours on a schedule for these patients, making every bite count, meaning to maximize the nutritional and caloric value of everything they take in, right? For example, with supplements, with very dense nutrients such as nut butters, avocados, and so on. Remaining active after food to help with indigestion. So especially in the context of traditional Chinese medicine, it's implied that you should keep moving, not sit down after a meal, right? And I don't mean a workout, nothing strenuous, it's just a gentle walk, as well as very gentle clockwise abdominal massage that can also stimulate peristalsis and help with digestion in some. And then for acupuncture, there is really quite good evidence that it helps with things like nausea, indigestion, constipation. So this is a tool we rely on very, very frequently for these kinds of symptoms. Of course, there are appetite stimulants that the oncologists often will work with and that we support too. I want to reserve a few minutes to speak about natural supplements because that's one of the main reasons patients get referred to us. Patients get interested in using herbal or nutritional products, and their oncologist will want us to evaluate for their safety in conjunction with their treatment, of course. And it's such an important topic because obviously these supplements are ubiquitarily available everywhere. And the information on them is very difficult to vet, right? People rely on things that they find in the internet or in the popular press and books. And there are several caveats that we have to mind. And instead of going through different herbs and substances, I'm going to name a few examples and demonstrate some of the things we have to think about when we implement or when we deal with supplement use in the cancer context. So, for example, graviola or pawpaw, so Brazilian or American pawpaw, is one of the substances that are now very, very much discussed in the cancer community. And a lot of patients come in asking for it or started to take it right away, right? It's readily available everywhere. And it's true that the leaves and twigs of this plant contain an alkaloid substance that in the laboratory, in the test tube, kills cancer cells. There have been some animal models, very few animal models, but there have not been good clinical trials. So that's number one. We really can't make that leap from a test tube study to the human use, right? It's a very big leap, and there are a lot of steps that have to be acknowledged in between. One of the main concerns that we have is how do herbs interact with other medications? In the context of pawpaw, this is relevant because it inhibits an enzyme in the liver that is also responsible for metabolizing several medications, right? So that may create an interaction with one of your medications, right? And finally, these are products that have, especially herbs, have potentially hundreds of bioactive compounds in them, right? It's not just one molecule. And some of these may have adverse effects, right? So, for example, in the case of graviola and pawpaw, there have been laboratory studies and also observational studies in populations with high traditional use of this, of neurotoxicity, of harming nerve cells, right? So we're dealing with substances that are actually medications, right? If they work, they may have an effect, but they may have a side effect too. So this is something we have to mind. So something as benign as a spice that is so commonly used, turmeric, or its most famous compound, curcumin. Again, very promising studies for several indications, including osteoarthritis, right? It's a strong anti-inflammatory herb. It also seems to inhibit tumor growth in cell culture and in animal models. And here, in this case, there have been some studies in gastrointestinal cancers, even in conjunction with chemotherapy, that are very supportive, but they're early, right? We can't safely put patients on this high concentrated herb if we're doing a curative conventional cancer treatment, because there's not enough knowledge of how they will interact. So curcumin has the same problem. It inhibits a very busy enzyme in the liver, right? The cytochrome P453A4 and several others, by the way. And this is a very busy enzyme system that will be responsible to metabolize several other medications and foods. And so it's really at risk for herb-drug interactions. Vitamin D. So this is a supplement that we often will encourage patients to take just because the prevalence of vitamin D deficiency is so high here in the Northeast. There have been some studies that demonstrate a potentially protective effect, right? However, it's not really an anti-cancer supplement. We don't know how supplementation will work. All we know is that some cancers have been found to correlate with low vitamin D. So if we find a low level, we will supplement. This is even a benign vitamin supplement. There are caveats. So, for example, in kidney disease, we have to mind the dose of what we replace, right? It can be harmful, and there are overdoses, right? You can overdose with this. So another supplement that I will mention, also because it's really popular in the press, and it's a traditional Chinese medicine herb, or it's actually a mushroom, right? So it's Coriolis Vesicle. It's also called turkey tail mushroom or yungzi in traditional Chinese medicine. And it's implied to have immunostimulatory properties. So it has, in the aerial part of this mushroom, there are polysaccharides very similar to the bacterial cell wall that our immune system seems to be responding to. And there's possible improved survival rates in conjunction with chemotherapy in gastric cancer in several small studies, mainly from Japan. Again, so even in something so promising that does not seem to have interactions with chemotherapy, with all other drugs, there are no known interactions, this product is not standardized. So if you see the name Coriolis on it, you may not get the compound that you need or that you want that has been used in these studies, right? So this also needs some expertise in order to consider taking that, of course, only in discussion with the oncologist. And, of course, certain preparations have been implied with enhancing cancer growth in the laboratory. So, again, we really want to mind exactly what we're taking, and there are certain standards that we have to look out for. So, for example, if you go out to buy Coriolis Vesicle, you might end up with a product that has only the mycelium of the mushroom, which is the part of the mushroom that grows in the earth, right? It's not a very clean product. Okay, so these are the integrative services that we have at Memorial Sloan Kettering, and these are some of the most common indications that patients come with and the modalities that we use to assist them. I also want to say that, you probably noticed that one of the hallmarks of integrative medicine is to really engage participation from the side of the patient and encourage the patients to use tools for their own self-care. It also helps, of course, that our treatments are pleasant, right, which can't be said about a lot of other treatments. Okay, so that's it.
Thank you.